Penicillin, a brief overview. Penicillin is an antibiotic that revolutionized medicine. It was the world's first antibiotic, discovered by Scottish bacteriologist Alexander Fleming in 1928. Here are the key points: discovery and origins. Fleming noticed that a mold called Penicillium chrysogenum produced a substance that killed bacteria. He famously found this out when he observed that a Petri dish containing bacteria had been contaminated with mold, and the bacteria around the mold were dying. This accidental discovery led to the isolation of the microbe-killing agent, which we now know as penicillin. Mechanism of action. Penicillin works by attaching to and damaging the cell walls of bacteria. By disrupting the bacterial cell wall, it weakens the structure and ultimately leads to bacterial death. This makes penicillin highly effective against various bacterial infections. Types of penicillin. There are different types of penicillin, each with its own specific properties. Penicillin G, benzylpenicillin, effective against both gram-positive, for example, streptococci, staphylococci, and some gram-negative bacteria, for example, gonococci, meningococci. It's administered parenterally, not orally. Penicillin V, similar to penicillin G but can be taken orally. Amoxicillin and ampicillin, these are broader-spectrum penicillins used for various infections. There are also semisynthetic penicillins developed through chemical modification. Clinical use. Penicillin is used to treat bacterial infections such as strep throat, pneumonia, urinary tract infections, meningitis. It has saved countless lives since its discovery. Resistance and risks. Unfortunately, bacteria can develop resistance to penicillin over time. Some people may be allergic to penicillin, so it's essential to consider allergies before prescribing it. In summary, penicillin's impact on medicine cannot be overstated. Its discovery paved the way for the development of many other antibiotics, transforming healthcare worldwide. Certainly, when using penicillin, there are several potential side effects to be aware of. Common side effects. Diarrhea. Some people may experience diarrhea while taking penicillin. Hypersensitivity. Allergic reactions can occur, leading to symptoms like skin rashes, hives, or itching. Nausea. Mild nausea is a possible side effect. Neurotoxicity. Rarely, penicillin can affect the nervous system. Urticaria. Hives raised, itchy welts on the skin may occur. Superinfection. This includes conditions like candidiasis, yeast infections. Allergic reactions. Approximately 1 in 100 people may have an allergy to penicillin. In rare cases, about 1 in 3,000 people experience life-threatening allergic reactions known as anaphylaxis. Remember that penicillin should only be used if the bacterial infection is sensitive to it. If you have any concerns or experience unusual symptoms, consult your doctor promptly. Basic structure. Penicillin contains 2 essential components. Beta-lactam ring. This is a 4-membered cyclic amide. The beta-lactam ring is crucial for penicillin's antimicrobial activity. Thiazolidin ring. This ring is also part of penicillin's structure. Antibacterial mechanism. The beta-lactam ring mimics bacterial cell wall precursors, such as peptidoglycan. By doing so, penicillin inhibits bacterial cell wall synthesis. Without a stable cell wall, bacteria become vulnerable and eventually die. Specific compounds. Penicillin G, benzylpenicillin, the most well-known penicillin. It's administered intramuscularly or intravenously. Penicillin V, given orally. Semisynthetic penicillins, these include antistaphylococcal penicillins, aminopenicillins, and antipseudomonal penicillins. Origins. Penicillin G, benzylpenicillin, is the natural form obtained from Penicillium molds. Semisynthetic penicillins are chemically altered derivatives of penicillin G. Production process. Industrial production begins with fermentation to produce penicillin G. Then, chemical modifications yield semisynthetic variants. Types of semisynthetic penicillins. Antistaphylococcal penicillins, effective against Staphylococcus aureus and other gram-positive bacteria. Aminopenicillins, broader spectrum, including gram-negative bacteria, for example, E. coli. Antipseudomonal penicillins, combat Pseudomonas aeruginosa infections. Clinical use. Semisynthetic penicillins treat various bacterial infections. They address a wider range of pathogens than natural penicillin. Biosynthesis of penicillin. The natural penicillin molecule consists of a lactam-thiazolidin ring and a condensed lactam ring. The lactam-thiazolidin ring is formed by the condensation of L-cysteine and L-valin. Biosynthesis occurs via a non-ribosomal process, involving a dipeptide composed of AAA and cysteine, or a breakdown product of cystathiamine. Subsequent epimerization connects L-valin, resulting in the formation of a tripeptide. The first isolated intermediate in cyclization is isopenicillin N. Benzyl penicillin is produced by replacing AAA with activated phenylacetic acid. Fermentation process. Penicillin production occurs through aerobic fermentation in deep tanks, fermenters. Penicillium chrysogenum is agitated in the fermenter under suitable conditions. Aeration is crucial, with an oxygen absorption rate of 0.4–0.8 mm/min. The required aeration rate varies based on strain, fermenter type, and impeller system. Uses. Approximately 38% of commercially produced penicillins are used in human medicine. Another 12% is used in veterinary medicine. The remaining 43% serves as starting materials for semisynthetic penicillins. Semisynthetic penicillins. These modified penicillins have improved properties, including acid stability, resistance to lactamases, and broader antimicrobial effectiveness. Examples include ampicillin, hetacillin, bacampicillin, and others. Challenges in large-scale penicillin production. Producing penicillin on an industrial scale presents several challenges, despite its remarkable impact on medicine. Let's explore these challenges. Environmental gradients. Insufficient mixing. In large fermenters, achieving uniform mixing of nutrients, oxygen, and cells is difficult. This leads to environmental gradients. Mass transfer limitations. Uneven distribution of nutrients and oxygen affects microbial growth and penicillin production. Negative impact. These gradients reduce productivity and yield. Scale-down studies. Researchers conduct scale-down studies to simulate gradients. True snapshots. Devices with fast sampling and quenching protocols reveal perturbed cellular conditions. Metabolome information helps understand the production process and identify improvement approaches. Flow field and intracellular metabolism. Flow field. Influence of fluid dynamics, flow patterns, on penicillin production is not fully understood. Intracellular metabolism. Mechanisms within cells during fermentation need further exploration. Rational scale-up. Developing a computer framework to simulate large-scale fermenter flow fields is recommended. Coupling a metabolically structured kinetic model to fluid dynamics will aid prediction and optimization. Improving penicillin yield in large-scale production. Large-scale penicillin production involves overcoming challenges related to environmental gradients, mixing, and mass transfer. Here are some strategies to enhance penicillin yield. Scale-down studies. Conduct scale-down studies to simulate gradients. Use devices with fast sampling and quenching protocols to capture true cellular conditions. Understand how environmental variations affect productivity. Flow field simulation. Develop a computer framework to simulate flow fields in large-scale fermenters. Optimize fluid dynamics for uniform nutrient distribution and oxygen supply. Metabolically structured models. Couple a kinetic model related to penicillin production with fluid flow dynamics. Establish a mathematical model integrating computational fluid dynamics and chemical reaction dynamics. Predict and optimize penicillin production over the entire fermentation process. Certainly, nutrients play a crucial role in penicillin yield during large-scale production. Let's explore how. Medium composition. The medium used for penicillin production must be carefully formulated. It should provide essential nutrients for microbial growth and penicillin biosynthesis. Key nutrients include carbon sources, nitrogen sources, minerals, and vitamins. Carbon sources. Carbon serves as the backbone for penicillin synthesis. Common carbon sources include glucose, sucrose, or corn steep liquor. These sugars are metabolized by the fungus, usually Penicillium chrysogenum, to produce energy and precursor molecules. Nitrogen sources. Nitrogen is essential for protein synthesis and penicillin production. Ammonium salts, peptones, or soybean meal are commonly used nitrogen sources. Optimal nitrogen levels promote fungal growth and penicillin biosynthesis. Minerals and vitamins. Minerals like phosphates, sulfates, and magnesium are vital cofactors. Vitamins, such as biotin and thiamine, support metabolic pathways. Their presence ensures efficient penicillin production. Oxygen supply. Penicillin fermentation is an aerobic process. Proper aeration, oxygen delivery, is critical for fungal growth and penicillin synthesis. The volumetric oxygen absorption rate influences yield. Challenges. Achieving uniform nutrient distribution in large fermenters is challenging. Environmental gradients affect productivity. Researchers study scale-down models to simulate these conditions. In summary, optimizing nutrient availability and maintaining suitable environmental conditions are essential for maximizing penicillin yield during fermentation. Sir Alexander Fleming (1881–1955), a Scottish physician and microbiologist, is credited with discovering the world's first broadly effective antibiotic substance, which he named penicillin. In 1928, Fleming observed that the mold Penicillium rubens produced a substance that killed bacteria. This accidental discovery led to the isolation of penicillin, which has been described as the single greatest victory ever achieved over disease. For this groundbreaking finding, Fleming shared the 1945 Nobel Prize in Physiology or Medicine with Howard Florey and Ernst Boris chain 12. His legacy extends beyond penicillin. He also discovered the enzyme lysozyme and was knighted for his scientific achievements. That was all. Goodbye.